Hi, my name is Dr. Peter Scheer. I am one of the leaders and co-founders of Citizens Public Health Literacy, but you can just call us CIPHER. CIPHER is dedicated to improving citizens' public health literacy by increasing the accessibility and transparency of public health information. We're made up of a group of dedicated public health graduate students and faculty from Columbia University's Mailman School of Public Health. And this is the start of our new YouTube series, which will feature discussions from our journal club and seminar sessions. In today's discussion, two of our student leaders, Michelle Rufrano and Kaylee Barrett, lead the discussion around 3 articles related to schools reopening in the fall. Due to the current pandemic, we're meeting entirely remotely, and so for the remainder of the discussion, there will only be the audio present. You can find links to those articles as well as their PowerPoint below in the description. I hope that you enjoy this discussion and be sure to leave your thoughts and comments below.
And so Kaylee and I are going to kind of like take you through some of the articles that were assigned for today. And I think this is going to just be a really, would just love to discuss this kind of there's just a lot of obviously things to consider, and we've definitely talked about this before. So this first article is really is based on committee recommendations, and they laid out a lot of different weighted items about who should go back to school and when. Their first recommendation, of course, was that we need to open schools just from kindergarten to grade 5, with the benefits of that, or just taking into the consideration that younger kids are going to struggle more with distance learning than older kids. They haven't necessarily developed, skills of self-regulation at that age. And it's, also critical that that kids learn to read at around 3rd grade. And that kind of neglect can lead to long-term adverse effects, especially for low-income kids. The second recommendation is that we need to read one's. Sorry?
Do you mind if I add? So something that was interesting about recommendation 1 was, they didn't explicitly mention this, but having schools open to children enrolled K through 15 takes burden off of the caregivers, and it's kind of mentioned in recommendation 2. But if everything was offline, you're assuming that there's at-home supervision during the day, and that the parents have time and are equipped to kind of help them walk through all these lessons, and that there's technology available too. So those were some things that I thought were interesting that they kind of didn't explicitly mention within this recommendation. I don't know
if totally. They definitely mentioned, childcare as something that, so schools provide like a safe nurturing place for kids. And then I think one of the other articles, like in tandem what you're saying, Kaylee, is just like, if kids can go back to school, then, productivity will go up. Right. Also in terms of, parents' ability to actually focus on their work. And of course, there's a gender bias here. Like a lot of new op-ed articles came out, like saying that women are being interrupted more than their partners, which unfortunately, makes sense based on what we know. But yeah, totally. And then just the second, obviously, schools are huge resource centers for mental health, for healthcare services, access to food. So these kinds of, it's really important that we think about, if we don't reopen schools, what will happen to those kinds of services and how will people access them? In terms of data collection, we can get into this more later with the other articles, but really the committee recommended partnerships between school districts and public health officials to really include a plan to monitor number of new cases of COVID-19 diagnosed, number of new hospitalizations and deaths, number of positive diagnostic tests for COVID-19, and also to monitor absenteeism in a more efficient way as an indicator of people are absent because they're sick or showing any kinds of symptoms. And really they were recommending that states take a leadership role in ensuring school districts have access to public health expertise. One of the barriers obviously being in places where there's not a huge public health influence, or just there's some neglect there, like rural areas. And then one of the other recommendations was to build a community task force to really kind of establish thresholds for, okay, so what does that data mean? If there's like 5% of new cases, does that mean that we shut down, or vice versa? And actually the New York Times opinion article really gets into that, what the threshold should be, and it really depends on who you're asking. And obviously establishing community values and goals at the outset, and review mitigation strategies and policy options for schools as well. And it's like one thing that I thought was good, at least in this article, that they acknowledge is there's no real way to eliminate the risk entirely. And I think people definitely do need to be more transparent about that. Do you want to? Yeah, so the best practices to lessen risk of transmission obviously are to ensure ventilation and air filtration, clean surfaces frequently, provide facilities, all of the things for regular hand washing, and provide space for physical distancing. This is obviously going to be a barrier for a lot of schools that are in very old buildings, have all types of public health issues already in terms of ventilation, air filtration. And do we even have the staff to clean surfaces more frequently? And I'm sure we've all been in the circumstances, whether at Columbia or school, or in our past, or in just in any institution where there has not been hand soap available, or the appropriate ways to to wash your hands in a space. So, and then also obviously one of the biggest issues in New York City public schools is that they're overcrowded. So how are we going to really address these issues? So do you want to go ahead, Kaylee?
Yeah, and then another thing that I thought was interesting, the very last paragraph is when they really start talking about equity, and they have a recommendation that it should be at the center of the entire response by schools, and they specifically list just ensuring traditionally marginalized voices are engaged in the decision-making process, and so that kind of points back to their community task force idea, making sure necessary services are accessible and resources are equitably distributed. That's a great list, and the last sentence of the article is just calling for people to take this as a moment and an opportunity to reopen schools in ways that enable them to better serve everyone that's coming into these spaces. But something I would have liked to see from this article is maybe a little more concrete solution or recommendation for schools. It's great that they're acknowledging that there's disparities in services and resources, but in physical spaces too. But it would have been great to have a little bit more concrete, somewhat recommendation of how schools that already are disadvantaged, how they can position themselves in a way to make everything a little more equitable. So that was kind of an interesting point. I think it's important, since we've been talking a lot about expertise, to kind of look and see who's making up this committee, expert committee, that's recommending all of these measures. So the National Academies of Sciences and Engineering and Medicine is an organization that come together to inform policy and to kind of create these committees. They're really big. They have a lot of leeway. They use evidence. They recommend for research, innovation, and really confront a lot of the challenges that are happening in public health. I won't go through all of the names here, but I thought it was interesting to kind of understand what everyone's background was and who was actually present in the room. So, it's 10 people, an expert committee. It's pretty epidemiology, I would say, heavy. If you want to go, let's see, I can just go through some of the names. Yeah, perfect. Yeah, sorry. So it was interesting just reading the bios. I mean, it was great that the bios were even extremely accessible from their site too. So if you follow the report, it's listed on the sidebar to look and see who the committee is. But this is how it's kind of broken down. So I don't think this is not necessarily a critique. I don't think it's bad that 50% of the people in the room have been involved in some research within their field. I think that makes a lot of sense, especially where the committee is coming from and the types of recommendations they're making. Something that was, I guess, interesting to me and a little troubling was only 20% of the people in the room, so out of the 10, right, it's a pretty small number, have taught in a classroom, but it was like in the 90s. So these are folks that kind of their expertise have really removed them out of classroom spaces and taken them farther from those spaces. I think both in time and just physicalities. So I thought that was something kind of important to note. I was kind of impressed by the range of localities that they represented. So those were some of the states, and I listed cities specifically too, because I think that's important, because I know, you know, Seattle's way different than Eastern Washington, and it's important to see, to make sure that like urban and rural communities and statewide supervision is also included. There's only one MPH holder. I don't think that necessarily means a whole lot, because a lot of these experts were engaging in other public health schools. So though they didn't have like the degree, they'd obviously been in some of these spaces. But yeah, like I said, no current teachers, and of the people that had taught in the past, it was all high school. And so none of it was actually the K through 5. While there was an expert on child behavior, a lot of his work was mostly rooted in research and pediatrics too. So it seemed like that would have been a good thing to have in the room as well. And I thought it was interesting, and I think the New York Times article does a really great job of this, but this report didn't have any recommendations of like, if your county is experiencing this many cases, like we recommend do not open. You know, it was more so just talking about reopening, and I thought it could have maybe used a paragraph where, yes, we're recommending things for reopening, but this is what you probably shouldn't do if this is happening in your county, state, everything. But yeah.
Yeah, thanks, Kaylee. That was, I just wanted to check in after this article. But they gave a lot of recommendations. Yeah, and Kaylee just gave a great rundown of who was giving those recommendations specifically. And like Kaylee said, they didn't give any kind of, it seemed very leaning towards we definitely need to reopen schools and know what ifs and whens and things about that. So wondering if there are any reactions to any one of these recommendations or about the committee itself.
One thing I was thinking of with the attendance and taking more attendance is making sure to not move towards or get away from like punitive measures that some schools might take for that, because things are going to be even more difficult, and that was kind of not a great thing anyway and kind of exacerbated problems with disparities. So I think keeping that in mind is definitely important, because there's going to be a lot more absenteeism, especially with COVID, and if you're taking more attendance and paying more attention to that.
Yeah, definitely. Yeah, and there's all types of reasons that kids are absent, and I know like just from, you know, talking to teachers, it's better when you do more in like kind of more of a qualitative deep dive into that and just kind of like seeing what's going on in the home. But yeah, definitely wouldn't want to be punitive about it, but that's also a possibility.
Yeah, and there's no mention too of families opting out if they want to, which I thought was kind of interesting, because I think, yeah, I agree with you, Matthew. Kind of seemed like just framing an absenteeism. If you're not there, then you're doing something wrong, or or you're sick, right? And having that, yeah, punitive kind of cloud over you. But yeah, that's interesting.
It's not even necessarily just about being sick, but also like taking care of sick family members.
Exactly, yeah. or I mean, transportation to and from school as well, right? There's no mention of, I don't think there was any mention of school buses, which is I don't know, was something that would be concerning. And then if, the parents aren't able to get kids to class too, based on other public health recommendations, that's an issue as well, and that aids in that.
Yeah, I was also just going to say, I think one of the things that I was trying to remember, because I read the article a few days ago, and I can't, for whatever reason, it's not loading on my computer right now, so I can't pull it up. But I think one of the really important concerns that has to be factored in here too as well is how you're going to deal with staff who get sick, and like how you're going to replace them, and whether or not you're actually going to even be able to find substitutes for that, and what the sort of protocols are for doing, testing and contact tracing within the school setting as well, and ensuring that you're containing any outbreaks that may crop up, especially when there's, a more significant proportion of children who are asymptomatic carriers of COVID. So I think there's a real issue there. I think that they're going to have a hard time finding substitutes in some of these cases, and it's going to be, and then any sort of ancillary staff where there is no sort of set substitute system, it's going to be near impossible. Just speaking as somebody that has worked in elementary schools, and I was a special ed para in an elementary school for 4 years, and when I was out, there was nobody to replace me. So they would have to, find coverage with another, staff to try and handle, 2 kids when that kid really requires a one-on-one, person to be with them. And especially when you think about some of the kids that have, more needs, like if you're dealing with, just as an example of like the types of children that I would work with, like a nonverbal autistic child, that really needs a one-on-one person, and it's required by state law according to their IEP and everything. And then that staff person gets sick. Like, what are you going to do? How are you going to replace them if they're out for 6 weeks because they got COVID? So.
Yeah. And I think too, yeah. I'm sorry. No, I mean, I have a friend who was doing exactly that work, and it was tough too because they were limiting the number of people in the classroom, especially adults in the classroom. So she had to be on call, and then that's a whole nother thing because if you want to keep the substitutes around and they're absolutely essential, you have to have them on call in some way. But she wasn't able to receive any unemployment benefits, and she ended up having to be taking off that on-call list because she's like, I'm not making any money. The schools aren't like, so there's so much intricacies, and I think that's such a good point with substitutes, and even the fact that it's great to suggest that we need to monitor cases and test, but also needing to acknowledge that not everyone's going to be getting a test. Tests like still aren't like readily available, and then even if they are, how long is it going to take to get the results back too? So yeah, it's just, I think there's, it just gets more and more and more complex. But yeah, no, I think that the substitutes is a great point. Sorry, Michelle, you were going to say something.
Oh, I mean, this entire recommendation, like Peter said, doesn't even take into account kids with IEPs and, kids that need, have special needs. It's assuming that everyone kind of has these similar kind of requirements in school, and that's definitely not the reality. Like, there's so many different learning stages, in every classroom, which is always really hard to deal with. And then what happens when teachers need to quarantine or out? I mean, school hasn't even started yet officially for one of my friends in rural Illinois, and she has to quarantine now because she was in contact with one of the teachers who just tested positive. So she's in her 5th day of quarantine, but if she had to go in, yeah, like the good thing it's early on, but I mean, I can't imagine what happens in the middle of a school year.
Yeah.
So yeah. Sorry, Julia, did you want to say something too? I feel like.
Yeah. This is the JAMA article, right?
Yeah.
Yes, I think so.
Okay. One thing that I do like appreciate they mentioned is kind of schools as a safe space, and I just haven't like personally read any articles about acknowledging like sorry about barking.
Yeah, no, yeah, schools, yeah, but that's a good point too. Yeah, they are a safe space for kids. Sometimes the safest space, and one of the other, I think this is where you're going, Julia. So like, just please chime in when you can. Yeah, just one of the things that we've been reading about is just that child abuse incidences have risen, is people are stuck in the home, which is unfortunately one of the places where that happens. So yeah, definitely acknowledging that the school can be a refuge for a lot of kids, and that is definitely one of the pros of opening. So, oh, you look like you're good.
Yeah, I'm good. Sorry, the mailman. My typical dog going after the mailman. No, yeah, that's like exactly what I was gonna say too. And they mentioned like how not dogs, my dog's barking again. How schools create safe spaces for those children, and that's just like something that I haven't read in other articles right now is like, what is the other option now if we want to keep kids at home? Like, what should we be doing? And like, I may have seen like some food programs and stuff, but it's not like enough. And I do like how this article like does mention like that as an argument of why we should go back to schools. I do think like the article also results in saying like, oh, the state should step in to do X, Y, Z. In a lot of these situations when there's like a lot of inequality, and clearly like that hasn't happened yet so far, and we've had like a lot of poor leadership from our national government, and that's really just like trickling down into like our state government not really knowing exactly what to do for each situation, and then it just like goes further and further, and it's just the spiral. So I think this article kind of is like wishful thinking that states will be able to step in and make some changes when in reality they haven't yet so far on this like really like no one has like this master plan that really seems to work.
Yeah, and they're overloaded too. There's been so much pushed to state authorities. Yeah, definitely.
Yeah, thanks for mentioning that. Yeah, because that is the recommendation. It's like the state and federal government needs to pick up the bill for, kind of maintaining, what is it, like all of these, like, like that air filtration systems, like all of the kind of things that we would need, in like from an infrastructure standpoint to make school safe for kids. And, it doesn't seem like, there's enough resources to go around for that kind of thing. And I mean, I think we've talked about this before, definitely in public health, that, school officials and public health officials need to kind of talk to each other more. But I have not really seen that happen. I don't know if anyone else has ever seen anything like that, or, besides like some kind of like, kind of one-off examples where there's like healthcare or medical care within school systems, which do happen, but they're more rare. And definitely not the norm.
I think that's going to be something that comes out of all of this. I mean, there's already like, I don't know if everyone saw it, it was circulated at least through SMS, but there was like a job posting for some public health advisee official to be on set for a movie. Like, I think like public health is going to just be kind of coupled with and into a lot of spaces that it hasn't been yet. And I think schools is definitely going to have to be one of them. Including workspaces.
Yeah, I hope that this will serve as a sort of opportunity for more school-based health clinics to be incorporated, in schools, because oftentimes schools only have a part-time nurse, really, and often don't have the sort of access to like services that they would need. And in the cases where school-based health clinics are available, it can be really powerful and helpful for kids. And really, in a lot of cases, is maybe the only place where they can have access to resources and like the services that they need. Even outside of a pandemic. Dr. Kohal, who some of you may be familiar with, has done a lot of work in school-based health clinics, and I think they serve a really important and valuable role in providing care for kids.
Yeah, definitely. Yeah, hopefully that is something that will change. Just, more collaborations with public health, schools, movie sets, whatever it is, like that. It kind of needs to be a part of everyday life. And hopefully this is the push that we can get forward, like get moving forward, because I mean, it'll be beneficial for all kinds of public health issues, whether it's asthma, air filtration systems are already needed in schools because of, just environmental pollutants and things like that. But maybe this is the big push. So hopefully, is there anything else that people wanted to talk about before we move on to the Lancet article, or anything you wanted to add, Keely?
Not at the moment, yeah.
Yeah, lots to talk about,
Yeah.
So so the Lancet article was really kind of beneficial in just looking at the studies that public health officials are using to make these recommendations. So I think one of the things that we're always hearing is that, do kids really transmit the disease as much as adults, let's say? And I think one of the big arguments out there is that, kids don't, when they do get it, it's more of a mild case, so there are all these arguments kind of floating around that are not necessarily conclusive, but these are the studies that a lot of public health officials are using, epidemiologists are using. So specifically when it comes to the reopening of schools. So the first study that the Lancet really talks about is a study done in Wales, in New South Wales, Australia. So in this case, this was like early on in the pandemic, so I think it's even before March that they're talking about. So there were 27 primary cases, so 56, so about half the staff. About 1,000 people were in close contact with them, or had some sort of secondary contact, and nearly half of those close contacts were tested. And it actually were not too much spread actually happened within the school. So it was a low number of cases in this case. However, the one caveat that they wanted everyone to take into account was that schools did close shortly after this study was done. So that is one thing that definitely needs to be taken into account with all of these studies, is that they are really based on data of kids not being in school fully, and definitely for partial closures. So even for this next study in northern France, so this was high in students. I think, hold on, can't find my other thing. Oh yeah, so this was among high school students. It was much lower amongst parents. So this study kind of suggests that the infection rate really stayed. It didn't really spread to other people in the home. So, I mean, and it really just kind of stayed in the environment of the school. And then there was another study that they kind of briefly mentioned in this Lancet article about South Korea, which kind of just showed that kids less than 10 years of age were less likely to spread the disease. And it seems like based on this data at least, that once kids hit adolescence, they're more likely to spread the disease to other adults, because obviously one of the things, even if we buy into the idea, and even if it's true, like based on the data that we have now, that kids get COVID-19 or experience the coronavirus in a mild way, we still don't know the long-term effects, obviously. And then also, if that is true, why is it at adolescence that kids are more likely to spread it to other adults? So these are like big questions that we don't know, and there's really not enough data out there right now, but these are the kind of conclusive studies that were done when school was still in session early on in the pandemic. So I forgot what's after this. Yeah, so the New York Times article kind of goes more into like testing procedures and like, protocols and things like that. Any reactions to just these studies or any other studies that you may have heard of about how COVID is spread amongst young children? Okay, so I'm going to move on to the next article. If there's...
Sorry, I was just gonna hop in real quick. I was just gonna say, I think that the data is like really inconclusive at this point. There isn't sufficient enough data, and the other thing is testing rates are significantly lower in children, especially young children, and so we just don't have the same sort of numbers that we do in the other sets.
Yeah, that's definitely true. Kids are not tested as much, so we really don't know the rates amongst them. I think, so this article really called for the importance of contact tracing, which I think, I know you are doing some contact tracing, and I think at least if you aren't a contact tracer yourself, we in the public health, I feel like, know someone who's doing contact tracing, and there are so many challenges involved with just getting people to cooperate with answering questions and, kind of giving that kind of personal data away. So, that's definitely something that we need to take into account when we look at this kind of like these case studies. And like I said, even the Columbia article, I don't know, it was like sent around in I think one of our channels as students. It was looking at the recommendations for reopening schools, and all of the data was based off of kids not being in school, because we've obviously had closures since March. So I feel like most of these are really inconclusive, and I just want to say we don't know. So that kind of adds some color to the committee's recommendation also, because they are really basing a lot of their all of their ideas and ways that we should be thinking about reopening schools off of studies like these. So I think we definitely need to, of course, like we've been talking about throughout our journal clubs, is where is the information coming from? How is it vetted? And where are these conclusions coming from? Additionally, and like, was pointed out by Kaylee, there were no K-5 teachers that were actually consulted in that committee. So that I find particularly concerning when we're saying that if anyone should return to school, it's K-5. And I don't know about you, like I never really worked with younger kids. I've always been more like worked with adolescents and older, but I can't, I feel like it's very difficult to instill certain public health protocol for younger kids. I even see kids on the street, I've mentioned this before, not wearing masks and their parents are like, well, I can't get them to wear a mask. And this is, this is the kind of like, kind of behavior that we can't really, I don't think that we can have any leeway there for, especially because most of the states of or protocols for needing to reopen have to do with kids following protocols like social distancing, wearing masks, not engaging in activities that are high risk, right? Like, like super spreader kind of activities, like maybe exerting yourself a lot during playing something like tag or something like that, or doing, any, obviously swimming is out, but so just taking all of those things into account.
Yeah, and I think something real quick about the Lancet article, like it's great that they're comparing these 3 different countries and populations, but I think I just like the U.S. Is so unique in that it's big. There's so many different populations, rural, urban. It's hard for me to we keep saying that there's not enough data, but yes, contact tracing is so important and it should be vigilant in all of the schools, but just in the US, I can't see that happening with the resource disparities that are just across, even schools that are only a couple blocks away from each other, and so it's so tough to, I think, take these numbers from a high school in northern France, right, and be able to apply to maybe what we're doing, what's going to be happening here in kids. And yeah, just the risk too has been really interesting because almost every kid I've seen both in Seattle and New York are without masks. Yeah, and I've just always, I don't know, it just seems like an unnecessary risk, especially if everything's unknown. But sorry, that's all I wanted to add. But because yeah, these are very different populations that they were inferring all this information from. But
yeah, definitely. Yeah, obviously it's useful to look at a global sense, but like you said, Kaylee, and I think the New York Times article really gets into this, is, most of the recommendations, the Lancet, the JAMA article included, are saying we should take it county by county or region by region, right, which is Como's recommendation also, and is that really okay? And maybe not. So if you haven't looked at this New York Times article, I kind of wanted to bring the actual one up, but I think it's a little easier just to look at it with slides, and I highlighted over New York County specifically. But this map literally allows you to hover over the entire United States, and based on the Harvard Global Health Institute, their cutoff points, tells you whether it's okay to open or not. And you can see that most counties are not ready to be reopened. We know, I think, from the public health data that we've seen, for New York City specifically, that New York State's doing pretty well, especially compared to the rest of the country. So it's possible that we are definitely one of the places that we could definitely try reopening schools, but there are so many other infrastructural issues that need to be taken into account. So definitely, this map is actually pretty interesting. So really the question that the article puts in place is that we really need to consider when reopening schools is the rates of new coronavirus cases and testing rates. So are the testing rates high enough? And are there the number of new cases low enough, right? So the Harvard Health Institute county, so what they, sorry, I don't remember. Yeah, so each county has to have fewer than 25 cases of COVID per 100,000 people. And for the WHO, it has to be fewer than 5% of those who are tested for the virus over a 2-week period actually have it, who actually test positive. So these are the 2 cutoffs that all this data is really based off of. So let's see if it can reload it. Okay. I don't know why it's happening, but okay. I might have to go into the actual article for this one. I don't know why it's not loading. Oh, maybe. So, okay, well, this one is really about which school or which parts of the country can reopen in which ways. So let me see if I can find the actual article.
I have it open, Michelle. I can.
Oh, thank you. I appreciate you.
Yeah, of course. Let's see.
But yeah. So yeah, there we go. So these are the recommendations based off those two criteria. So this first one with all of this like kind of peach or red, whatever you want to call it, schools should just stay remote. So that's most of the country, most counties in the United States. Moving to the right, elementary school and middle school can reopen and high schools can stay remote. So that's, you can kind of see that splattering. And then elementary and middle schools in this like bottom left can reopen, and a high school partially remote. Another kind of splattering, and then safe to reopen all schools is a very rare event, it seems. Maine, parts of California. But this is like I said before, this is a very interesting way of thinking about this, county by county, region by region, as if people do not travel between region counties and things like that, and we are not taking that into account really when we're thinking about this. And I found that pretty interesting that they didn't even mention travel at all as a possibility. And what's going to happen when we lift those quarantine, those aspects of quarantine that are, or those statutes of quarantine that are already in place.
Yeah, one thing I mean, this is a great representation, but it also scares me a little bit just thinking from like our cipher lens. Just when you see like the red, the orange, the yellow, and then the green, safe to reopen all schools. It's like, this isn't like, once you get the green light, it doesn't mean you're good for the rest of the year, right? And so I think that's something too, and I know it talks about it a little bit, but like, and the Lancet and the other articles do a great job of like, you need to monitor it because the situation's always changing, but being like more explicit, like with stating that in visuals too, because I think, I mean, I'm drawn to visuals, I know a lot of people are, and that's the first thing they'll go to, and if they see their county, they're like, sick, like we're good, like we're good for the rest of the year, like the kids in school. But it's like, making sure that we're still like, this is like a spectrum and it goes up and down depending on the cases and everything too, is something that's important. I think that isn't properly or relayed a lot of the time and needs to be relayed more. But, and that goes back to the whole transparency talk that we talked about in the first article. But yeah, do you want me to switch back to, sorry.
Oh yeah, all right, there's actually another one. I don't know if you scroll down in this article that, like, I don't think it's showing up. This one, yeah. So, so this criteria is also based on if there's enough testing. And again, it depends on who you ask. There was a leak, according to this article at least, of the US government, and their positivity test cutoff is 10% positive test rate for a pause in reopening schools. For the WHO, it's 5%, and for Harvard, it's 3%. So, you know, this is not just an arbitrary number that I think we can adhere to like we do in some cases with Biostat. But this is, you know, in this case, I would like to be more conservative and I would like to lean more towards Harvard, but, you know, our national government is going for less than conservative in this case of 10% positive cases. So yeah, like you were saying, Kaylee, the transparency of how we're really thinking about this needs to be put into effect. We're not thinking about how this is a scale, and even the Columbia article that I mentioned previously that was circulated amongst us, they are counting that we are going to have to pause at some point for second wave upticks or third wave upticks. So what happened? We have to pause, go remote again, and then reopen, because that is also likely to happen, like you were saying. So
yeah, even adding a sentence here where it says California is doing a similar approach, watch list, right? And it's like adding a sentence here that's like, as these results come in, people can go back on the watch list. Like there, you know, there needs to be that, like, yeah, sorry. Not to belabor that point, but that's been bothering me when I've been reading stuff. But
let it out. Yes, I think that my my other one will work now for some reason. I don't know why the graphics didn't work, but I'll figure it out later. But okay. So you were also mentioning this before, Kaylee. We're not really taking into account the issue of disparity here. So it's much, according to this article, according to the data, and I think most of us can agree with this based on what we've read or seen, that, well, first of all, like this is a race issue, right? Whiter countries, or counties rather, can reopen sooner. Simply because of the resources, the availability of testing, the ability to adhere to those public health protocols that were mentioned in the earlier articles, like air filtration, social distancing capacity, space, right? All of those things, or even having access to public health officials. So there's definitely a racial component here, and then also a class component, right? Richer counties could also reopen sooner for much of the very same reason. So I really kind of liked how this article ended. I mean, even if I wasn't like completely happy with the way that they laid out everything, but it was just like, are we really thinking about this as an isolated issue of region by region, county by county, as Como was saying also? You know, he kind of like said this sarcastic thing in the news the other day, like, you know, I'm not like just, you know, this is based on the data. I'm not just like, you know, feeling the weather or feeling things out. Like, I'm not just getting a feeling about things. Like, this is based on the rates of new cases and things like that. But he's also going by a region by region kind of analysis. So for me, you know, the whole problem with how we've really looked at this problem is that we've individualized the issue so much by this state and that state, and you can do what you want and we'll do what we want. However, with a global pandemic, we are affecting everyone. So is it enough that we're taking it region by region and county by county? And that what happens when are we to just let these counties that have less already because of systemic injustices fall behind? And there were so many arguments about the negative effects of not reopening schools for kids, levels of reading, long-term adverse health effects because of lack of, you know, self-regulation, or lack of being taught how to self-regulate, and all of those things that socialization allows in the home. Having parents that might not be able to monitor you as much. You know, in the 90s, like we talked about, like the movie Home Alone, and that theme was really a funny way to acknowledge that most kids were, or at least kids that were of low income and even some of middle income and working class, were being raised by television. So while just simply because of the feminization of labor, women were going back to work, are we going to see similar kinds of issues? One of the things that, you know, when as the educator that we really want to purport for younger kids is that we teach critical thinking skills, that we show kids how to collaborate with others. We show kids how to be creative. Most of the jobs that we have now were not in existence when we were children. So I think in this workforce, Generation X, Y, Z has really had to, you know, use the skills that we learned when that were maybe more objective about learning as a continuous activity and learning the value of failure as a teaching tool. I've really had to use those to push ourselves forwards in our career, to learn new skills on the job, to pivot, to be a flexible global citizen. And are we really able to do that? And are the disparities just going to become more great? So not to be super doomsday and everything, but, you know, it is what it is. So, you know, I have this kind of like general question, but would love general reactions from everyone to the 3 articles. I thought that Kaylee picked these. I thought they were really great ways to look at this issue from a variety of viewpoints. So we'd just love to hear, your feedback.
I just want to say I really appreciate you all kind of like raising this discussion. This is something that I've been thinking a lot about. I'm sure other folks have as well. I mean, I really just kind of think it's like a no-win situation, really. Like, you kind of lose if you reopen schools, but you also kind of lose if you don't. And I also appreciate you saying, Michelle, that like, you know, each of these counties, they don't exist in a vacuum, you know, like I'm thinking even like in New York, for New York City, like teachers or staff, like they might commute from like New Jersey or upstate, or they might be coming from a place where there's like higher rates of COVID. So it's not, you can't just assume that everyone who's going to be involved in the school is going to be in that county or the counted as part of that county. And another thing is like, I also feel as though the New York Times charts are kind of relying on a bit of like false precision. Like I think, the testing rates and like availability and also like the timeliness of results have been an issue since the pandemic started. And I don't really see any indication that that's going to improve. And so, and there have also been states who have, been shown like kind of hiding or trying to like downplay their case rates and also access issues as well. So I think, it's kind of hard to rely on this data to make these decisions when, there are a lot of states where it might not even be completely accurate.
Yeah, I agree, and especially just piggybacking off of the comment that you made about the New York Times maps and data visualizations. It's interesting because I look at them and I'm just like, wow, these are so pretty. They look so great and they look so, scientific. And I think that, they are to the extent that they can be in a lot of ways, but they also are still, because maybe they're trying to be geared towards a general audience, they're not always completely specific about what exactly they mean. So like the map in particular, I was looking at and I was like, okay, well, if I was just looking at this map and I just saw the map first, which I did, I think, I don't even remember, with that before starting to read the actual article and the guidelines they were talking about specifically, I think it has like a title that says "Are schools safe to reopen?" and you can just have this binary thing for each county, and it still looks really precise because it's this beautiful map that's like so at sort of such a granular, appears to be such a granular level, but at the same time you have to be really careful about how you interpret that kind of information. And obviously not everyone has sort of, not everyone is going to have even the sort of time or attention to consider that, whether or not they have kind of the educational background to have considered doing that. So yeah, that was something that I was thinking about.
Yeah, statistical literacy is obviously a huge issue. And I think, I was really impressed by the first map too. I was like, oh, look at this is so cool. But, and then it's like, I think they try and kind of temper it with the other maps, like, oh, like these are the cutoffs that we're using. But you're right, they also use kind of like, oh, look, Harvard says this and the WHO says this. And I feel like it's a little bit of an academic name drop of like, look at how like valid these measurements are. When we look deeper at like the Lancet and we look deeper at these maps themselves and new case testing and the challenges that we know about contact tracing and all of these things and really the intricacy of that, is it really accurate? It's much more of a complex understanding than like that binary that you referred to. I agree, for sure. But yeah, so okay, I'm just gonna read Alex's comment out. Agreed about the need to look systemically at these issues. The race and class analyses help explain the map shown earlier, particularly all in the red in the southeast US. I lived in South Carolina for the decade before Mailman, and I'm worried about the exacerbating impact of hurricane season, which is just beginning and slated to be harmful. Evacuations will probably be necessary, which will further disrupt education and increase COVID transmission across the region for people who are unable or unwilling to evacuate. They could also be cut off from health services or testing in their town. Yeah, thanks for that, Alex. I think, I keep going back to the fact that we're thinking of school reopenings as if it's in a vacuum, like you're saying, like there's not these other environmental issues that we need to take into account depending on region. There's as if, you know, other bad things don't happen in our world in terms of risk assessment. I mean, there's like a study that even shows that when the average American goes to work, they, you know, don't necessarily even take into account that things may go wrong. They just take into account how long it takes to get there on a normal day. So if it's not really part of our normal risk or our usual or typical risk assessment to think of when things go wrong, and if we're only focusing on this issue without all the other compounding aspects, things like weather, right, which will definitely prohibit certain people from going to school. Things like transportation, like Haley mentioned before, whether can you get your kid to school in the new protocols? Everything is more delayed during COVID. Train systems, bus systems, all of those things, because we need to take into account for social distancing. Yeah, so thanks for that, Alex. Any other comments?
One thing you had said, Michelle, that I've been thinking about a lot too is, so I have two things actually. So one, sorry, I should have formulated my idea before hitting unmute. The first thing is just, this is such an interesting and like pivotal time. And I think being like a public health student too, and just going through the classes and reading about all the legacies of policies that have really disadvantaged minority communities, and how like when we study those constant, this just seems like a decision that is 100% in that category. And if it's not made, and it's tough because it is a no-win situation, like Julia and Jennifer were saying, but it's definitely when it's like, I just think it really needs, I mean, that first article, like there really needed to be more teachers in the room. That really bugged me, because it's like, there needs to be more localities represented, teachers at different age levels. It just, for me, it just seems like this is another policy, if it's a misstep, that will 100%, like without a doubt, exacerbate, racism legacies. I mean, just looking at that map too, it's just like I see redlining, and it's interesting to be at this point where it's like, this is a policy that if it's not taken with the right precautions, and like equity really isn't at the forefront of it, and we're not having these conversations, that like a public health student, 20 years from now is going to be reading about how this all went. I mean, we already know that all of this is going to be in the textbooks. That was the first thing. And I think I'm totally losing what the second thing it was about, the statistics. Oh no, it was interesting picking these articles because the way we presented them is actually how I picked them, kind of. And it was really interesting going in that order, from like recommendations to a little more in depth about what people are doing about transmission rates, and then seeing those maps at the end, because I was like, why am I reading those articles if like this map is bright red? And like, I think that just kind of shows, like, even without reading the articles, like, why are we talking about opening schools if like this is this violently red? And I think that just also just kind of points to the power of visualization too. But yeah, those were my two little, sorry, not so formulated thoughts. But
not to call anybody out, but Dr. Bob, I would be really curious to hear your thoughts as the long-term educator in the room on like how you're thinking about these issues, if you're available to make a comment.
Glad to hold on, I had to get my mute button to work. Glad to comment just because I just came away from a podcast with a bunch of folk who are virologists. And they are, for the first time, understanding the economic importance of schools. That before you open up places of work, if kids are staying home with their parents, then you got no workforce. So the idea that maybe we haven't paid enough attention in the national discussions about this, on how without one you can't have the other, it's definitely led to a number of interesting conundrums. And for all the folk who travel in countries where you have a one centralized Ministry of Education, trying to deal with the US, 50 states, 10,000 school districts, some elected, some not, some appointed, some not. It's literally herding cats, trying to figure out how to come up with a national policy that's going to do this. And as a consequence, a lot of people believe that what will delay the restart of the economy is not going to be business. It's not going to be investment. It's not even whether or not people have money in their pockets. It's whether or not schools play the role that they have played for the last 100 years of making it possible for adults or parents to go to work. It's going to be interesting to see.
Yeah, none of them mentioned after school programs, which I think is after school programs are very very overlooked, and it's unfortunate because they do so. I mean, I was in after school programs my entire life, basically, because both my parents needed to work full time. So I mean, just even like that not even being in the discussion, and a lot of the things that we've been reading too has been concerning as well.
Yeah, some of you who took my evaluation class might recall that one of the articles I had you read was an assessment of an after-school program that basically began with the notion that somewhere between 35 and 40% of all school kids in the United States, for a variety of reasons, have to be in such programs. And they're routinely ignored because they're not licensed in many instances. They're not really part of the school. They're very, very informal. So the quality of what goes on there depends, once again, on what's happening in the community, where are the funding resources for educational programs likely to be, and to what degree does it also constitute yet another major disparity in American life, where rich school districts can afford it, the ones that struggle, that have a large population of working class poor folks cannot. Yeah. Once again, it's all bound up. The idea that, and Michelle has done a great job with this, of us, just as a nation, not recognizing how central schools are. The one guy who gets this is Donald Trump. He's been real clear. No, you got to open up schools. You got to open up schools. Because as a guy who owned a business, I know that he's more aware than most that if the parent says, I'm sorry, I got to stay home with the kid, there's nothing you can do about that. The idea that you would abandon your child to go to work, we haven't fallen to that level quite yet. But in the interim, while this is still such a central part of who we are as a nation and such an important component of the economy, the failure to pay appropriate attention to this is going to come back to haunt us, no question about it.
Yeah, I've been talking to some of my teacher friends, and they kind of feel a little disenchanted just because it's, teachers have been an undervalued resource for a very long time, are some of the most educated people in the economy, but make less than, people who have comparable education as they do in other facets of the economy. And even the JAMA article, I think, tentatively mentioned childcare as something that was beneficial about reopening schools, to not kind of reopen that wound that teachers are kind of babysitters. Because I think in a way that is what people really think about teachers as what they do, but that is really far off. But that is something that we need to think about. How have we been treating the school systems in the past? How have they served the economy in certain ways? And how do we acknowledge this resource? And there's been a lot of criticism on both sides. Healthcare workers even writing op-eds about how teachers should just bite the bullet and do their jobs. However, this is a large undertaking for anyone to do, in addition to having an objective of learning in a classroom with kids who have not been in school for the last, 8 months. That transition is also something that I would be, I think that people need to think about that. How are kids going to return to school after they've done remote learning? What have they even done? Has there been a huge gap? There's so much research on summer learning gaps, especially in disparate communities. What happened this past 8 months that might have put kids behind? because maybe, you know, remote learning is really hard to do. And I think as an educator myself, something that I always say is that I don't really teach people, I teach people how to teach themselves. And if we don't have that self-efficacy, and I think something that I've also been talking to other teachers about is the kids that need help and have trouble asking for help to begin with, that you might see in school, just like with telehealth. And you might see, you know, a doctor might observe something in a patient, as a teacher might observe something in a student that needs to be looked into closer. That opportunity is not there with remote learning. So what has happened in these last 8 months? That's something that also needs to be assessed. But would love further comments on any and all of these issues.
Sorry, if I could, I just wanted to share, actually, so one of my high school teachers that I'm still like fairly close with shared this post recently that she wrote, and I think it touches on several of these things and sort of highlights the frustration and like anger that many teachers are sharing. So I was just gonna share my screen real quick and show you guys, because I think it highlights several of these things, these frustrating things that are happening. So I can read some of it. I'm so tired of teacher bashing that's occurring right now as our governor makes this announcement regarding Minnesota schools. I'm going to do my best to stay off social media. Here are a few of my thoughts on the subject. Teachers are not solely responsible for deciding what schools will do this fall. In fact, we have little say. Teachers are not paid for the summer. Most of us are working for free to prepare for what's coming. And if it's distance learning, I'll be working most of August to prepare. Even if schools open, they won't look the same as they used to look. Social distancing means many things won't be able to occur. Teachers aren't the only adults in school. This is something that we talked about as well. There are many other employees. Teachers want to be in their classrooms with their students. That's why we teach. I dread the idea of not getting to know my students face to face. Distance learning or hybrid learning will be more work and more hours for us, and it's not what we want. We do care about kids that are not engaged and will work hard to get them involved no matter the situation. By the way, some students aren't engaged even when in the classroom. We can't just gear up and work similar to other professions. My building has 2,000 plus students in it, and we don't have the supplies or equipment necessary. Most of us are parents, and we understand the hardship distance learning places on parents and families. If schools open and we have positive students or staff, I assume we will need to close anyways. Subs are not going to be willing to come into our building. So what happens if teachers get sick or they need to take care of a family member? There's no good solution to this. Please keep these things in mind before you go off about teachers being lazy or selfish. And I think that highlights a lot of the complexity of this situation that we're talking about, and gives a perspective of it. You know, a longtime teacher. She's been a high school teacher for 30 years and you know, has a lot of experience, and I think that's another point too, is that many of the staff and teachers are also high risk themselves. You know, if they were to be positive, there's you know, serious consequences for them, you know, potentially.
I feel like this really highlights just the way that we put so much on teachers in just generally in society. And like, I think I saw a tweet recently that was like a teacher talking about how he was in a training for how to do a socially distanced active shooter drill. And I was just like, this is just hell. Like, what has happened, and how have we gotten into the situation in the first place? But more specifically, how are we putting teachers in this position consistently all the time? Why is it that it always seems to fall on teachers to kind of save the children from things that, you know, are not about education?
Yeah, thanks for sharing that. Yeah, both the blog, yeah, and your comment, Rachel. It's just that's another thing. There's been an uptick in violence, during COVID, and something that when I was talking to teenagers who I work with, one of their biggest fears were mass shootings. Is it going to be my school next? And this was something that they were extremely, tense about, and known people in other schools, specifically the kids that I knew people in Parkland, for instance, and this has become, so a place that, can be a safe haven, can also be, an area of anxiety for a lot of different reasons. So how are we going to, take care of those issues as well, or address those issues? How do we keep people safe, even from each other or from, lashing out? If we're in a much higher tense situation, what kind of, are we going to see a different kind of bullying? Because we all know that exists in schools. How are kids relating to each other at all? And I think mental health is something that has been neglected, and we can't say that we even did it well when kids were going to school. So how are we going to address it now when we have even less resources to see how they're doing? Definitely things to take into account also.
And I think mental health of the teachers too, and like, is there going to be support? And I mean, if there's already so much strain and pressure, I mean, we saw that with healthcare workers. And I think just because they're the face of the classroom and that's the first point of contact, and that's, it's like, it's the first person you field your complaints to, and it's just that on top of everything else, and then being pitted for all the decisions that are being made when they're not even in the room. It's like an exact same situation as healthcare workers to that extent. So how do you implement like kind of emergency medical or mental health care, and is that even being kind of like talked about or formulated?
And I think beyond just mental health, like, I mean, the trauma of, having a teacher or a staff member at your school pass away from COVID, or, potentially, like, if you're a child and you bring home COVID from school and infect a member, like, I feel like that's something that like we don't even fully like understand what the impacts of that could be.
I think that's a super important point, because people have already lost family members and kids have already been dealing with that grief too. So, I mean, do kids even want, if they really understand what's going on? I mean, everyone's anxiety is heightened and it feels like a bad situation, and kids pick up on that. And so, especially if they've already been grieving a family member, like, do they even want to go back to school? And like, where's the anxiety around that too? No, but I think it's a really good point, Jennifer.
Yeah, I think when I was working with kids, we always talked about how they kind of came in with a backpack, of things, that past experiences that have impacted the way that they behave. And, I tend to look at behaviors from kids as a form of communication, whether it's acting out, especially acting out. And that might be really difficult to deal with. And I think, I don't know if anyone else read this article, but even with remote learning, there are possibilities of heightened trauma. I mean, I think there was intimate partner violence that kids were witnessed just by, having a kid, who had it happen to them in the home, and being, on a class Zoom call as we are now, and the teacher being able to mute that, but it's still being very visible for everyone. So, I mean, and just like the anxiety of that kid that it actually happened to, and then it also happening to the entire classroom, the teacher, there are just all types of things that are going to happen in different ways that we are ill prepared for, outside of the issues that were relayed in these articles. And schools as these hubs that push our economy forward. There's just so many. We obviously don't want our economy to collapse, but how can we really rethink these structures so that they're beneficial for the people that attend them and also for the role that they play in our society? It's a hard question to answer.
Yeah, Michelle, I think what you said, like, it kind of blew my mind because I can't believe that this isn't something that's really come up, but like the student voice, especially for older students who are, able to articulate, what they think would work best for them. Like, I think that's something that's just been so completely absent from this conversation.
Yeah, I mean, let alone there were no K-5 teachers in that committee, let alone students themselves. And even very young kids can relay how they feel about a situation. And none of those voices are really being heard. And I think, maybe that's something that we can do as public health advocates, is advocate for youth voices in a variety of ways. And perhaps in the studies that we do, going forward, and I mean, hopefully in more immediately impactful ways of a different type of social listening. What do kids feel about going back to school? How are they, assessing this risk? And we talk about this a lot when we talk about sexual education as it being a right. Are those some of the same arguments that we should be bringing up here with consent? Of going back to school? Should we be asking kids for their consent to return to school if their parents decide that? I don't know. Like, this is also another kind of complex issue that hasn't really been talked about, or I haven't seen it at least.
I think you want to be clear that some of the conversation is going on as if the social difficulties and struggles of the moment haven't always found their ways into schools. Washington Heights in 1990, when a substantial portion of the population was on crack, had schools. Large numbers of parents were using the drug. I will never forget in Newark, trying to do an after-school program where we had a bunch of really, really motivated Black kids who really had visions of higher education, saying, well, we'd like to make sure that this gathering is continued. Can we have a name and an address so that we can contact you whenever it's over? Not one of those names or addresses or phone numbers was valid. That's 1990. That's 30 years ago. And why wasn't it valid? Because what we were looking at was a school district where you might have been in a school based on your address, but that's not where you lived. The number of people who were living with an auntie who wasn't really related to them by blood, but that was the place where you were raised, or who hopped around from one place to another just so that they could attend school. These issues have been with us. 1 out of 5 children in New York City goes to school with a weapon, it's been estimated, in neighborhoods like this. And all of us, I think, survived high school. I mean, who amongst you had a movie star version of high school where you sailed into higher education because the best years of your life were in middle and high school? That doesn't happen to anybody. And more than anything else, I think we've forgotten that in the 80s and 90s, one of the most important questions raised in a presidential election, what was your stand on schools? What have you heard about that from either of the candidates? It's not even mentioned. I was in the Department of Education when the report called A Nation at Risk was issued. Anybody even hear of that report? I found it on Google. Let me read you the one line that sticks with me today, because I was in the department when this was going on. If an unfriendly foreign power had attempted to impose on America the mediocre educational performance that exists today, we might well have viewed it as an act of war. That's from 1983. So that was at a point when the Department of Education and the National Commission on Excellence in Education was absolutely all about, we got to pay more attention to schools. And what's happened in the transition from then to your own lifestyles? Education has disappeared. It is no longer part of the national conversation about how we identify ourselves as a nation, about how we think about progress. Now it's divvied up into a variety of questions: private education, public education, homeschooling, what have you. What you're reviving is the notion that there used to be a time in the US when a national conversation on education was possible. Now it's not. It has become largely local. In some places, it's even an issue of the neighborhood and the municipality. So COVID is giving us an opportunity to revisit all of this stuff. And you're right, it's very important. And isn't it interesting that it's being carried out largely in a conversation that we're having now by folk in public health, not people who are, quote, educators, as you have indicated throughout our conversations today. That's a voice that, for all intents and purposes, has been lost. This is the one area of the functioning of American life that I worry about most, because I don't know how we revive the notion that the future of the nation really depends on the quality of its schools. That's no longer something that we believe. And it's no longer something that's so important to our ideas about who should be president that it is a prominent feature of what people argue when they say, I should be president of the United States. That to me is really scary.
Yeah, thanks, Dr. Bob. Yeah, schools as something that is not part of the political agenda is intensely terrifying, especially when we're all thinking, I think, it's August. We need to go back to school now. For us, it's remote. For many universities, they're opening partially or doing hybrid models. And that's when we think about higher education, most of the time people think of it as a privilege, yet it's something that one really needs to thrive in our society. So it also, I think, needs to be thought of with an equity lens as well. Many of the young people that I've been speaking to are mostly all going remote. Most of the private industries, for people that I know are working for places like Aetna, and other private industries, they're not going back until January, and that is tentative. And I think that's something that we need to think about and compare. What are private schools doing that have smaller populations? What private schools have closed because they simply cannot go on with the funding that even they have? And I think thinking through these challenges and I really think it's a mistake to really think of this in a regional basis, on a county basis. I don't think that we're isolated. And I think that all of these issues are going to overlap with each other, for sure. We only have a few minutes left. Would anyone else like to have any closing remarks? The question I really wanted to answer is, what would we, as public health officials, and maybe that we can table this, what would we recommend to teachers, to faculty, to parents and guardians, to students themselves? As public health officials, what arguments would you pull forward from these articles and other things that you've read and other people and other testimonies you've heard of? I don't think it's a very clear message, not for myself, and I think it's a very hard argument to package either which way. But would I love any comments on that?
I don't know, I guess for me, I'd just advocate for more and like the importance of qualitative studies. Because I think just thinking about like absenteeism being like the marker of students potentially getting sick or not being able to go into schools, I mean, that's just like a purely quantitative thing, and you need to dive in more and ask questions. And I mean, what you were saying, Michelle, about just like hearing voices and being informed that way too, I think I think that's something that should have been going on. Because I mean, you can in some ways like quantify qualitative answers, but I think like doing that like deeper probing, getting more into just the mass extensiveness of all the issues, and hearing from different stakeholders too, I think is important. I think we're kind of a little past that point, and it's something that I would advocate to like do while things are reopening, is But I think that's something too, just in general in the pandemic, it's been very like quantitative study driven, and that makes sense, I think, from an epidemiological standpoint. But for these types of policy informed issues, I think, yeah, just advocating more for qualitative research.
Yeah, I echo at Kaylee, and talking to the people who haven't really been spoken to in these papers, like the teachers and families of all different like socioeconomic backgrounds, racial backgrounds, like different cities, rural, urban, and students. Like I haven't really seen articles where they're like these public health articles where these people are being interviewed. So really including those voices.
I think personally, like the greatest mistake of this pandemic was actually putting economists at the forefront of this thing. Like if we hadn't listened to economists and listened to public health professionals, we would have been out of this so much faster. And I think that to value, we need to actually, if we're going to help teachers, if we're going to help students, if we're going to help everybody, we need to start valuing human life over the economy so we can actually fix the economy. Like those things go hand in hand. You can't lose 1 million people or 3 million people, whatever 1% of the US population is, and think the economy is going to be fine. Like it's not. That's so many people though you'd be losing. So we just, the plain and simple, we just need to start valuing human lives over the economy.
Yeah, I think, and I love that addition. And honestly, maybe that's an argument that we can make from a population standpoint is to an economist is what about the value of the workforce? Who are we losing? Our working age structure is going to shrink if we put more people like this at risk. You're thinking of an immediate that we need we need people to go back to work for the of childcare, but what's the long term here about our population losses? And that's definitely not something that I've seen explored very well. Thanks for tuning in, everyone. Thanks for a wonderful discussion. Happy to keep it going, of course. And hopefully we can take some of these wonderful suggestions into account in a more concrete way.
If you would like to see more content like this, please like this video and subscribe to our channel. If you want to learn more about our work, be sure to follow us on social media and check out our website, www.decipherpubhealth.org. Until next time, stay safe and stay healthy.